So I'm the Chief Program Officer for NAMI at the national organization. Who we are is a group of 650 different state organizations and affiliate chapters across the country. And again, you may be thinking, why is NAMI part of this presentation? You've heard some of the other presenters talk about the mental health component. But mental health conditions and what people who receive that diagnosis of cancer that Courtney, you mentioned earlier in your presentation, have some real similarities. So I want to ask you to think for just a minute, not about oncology specifically, but about people just in general. And let me walk you through who we are and then talk about why I'm asking you to open your mind for just a minute. So again, we are a group of about 650. We've got probably 200,000 members. We're a little bit of everywhere. We're not in every community, but I like to tell people we're kind of like a spider web. We're similar to the Heart Association or the Cancer Society, if you will, that there are organizations in each state and in communities, and we do four basic things. You can look at them as buckets, or you can look at them as legs on our stool, but we really do four different things. We advocate for research. We raise funds for research, typically around mental health conditions and neurological conditions. But it's also about how those conditions intersect with others. We provide education, we provide support, and we provide advocacy. And you've heard every presenter today talk about the need for advocacy in terms of payments, in terms of parity of service availability, the inequity of first of all, the shortage of treatment providers across the country in all the spaces, and the extreme shortage of providers who look like us, whatever the us happens to be. And that's true across the board. So those are the four big things that NAMI does. But why am I here? Why am I here talking with you today? Why is this important? It's important to be able to drive the slides. At any given point in time, 1 in 5 adults are experiencing symptoms of a mental health condition. We all have bad days. We all have bad moods. We've all had grief reactions to something that maybe we worked through relatively quickly. When we talk about mental health conditions, we're really talking about something that's more pervasive, something that interferes. The symptoms are to the point that they interfere with your ability to function at work, at home, at school, those types of things. So again, 1 in 5 adults at any point in time. We know that 60% of adults and 50% of youth who have a mental health condition never get treatment. They never go for treatment. A big part of that is stigma. The stigma around having a mental health condition, the stigma around having a chronic condition. You see the number on the bottom of the slide. Suicide is the second leading cause of death among 10 to 34-year-olds, and the 4th leading cause of death among 35 to 54-year-olds. Again, stigma applies to not just getting mental health treatment, but it applies to clinical trials. There's a stigma attached to asking for help. There's also fear and distrust. You can tell I have a little bit of an accent. I'm in Mississippi. There is a very deep distrust of researchers and clinical studies in the South, particularly in the Black community. But we're the Bible Belt. There's a distrust of science here. So you have those stigmas as well. The virtual world has helped a little bit in terms of allowing us to reach people virtually without people having to come in personally for support services and for education services. But given everything you've heard from the previous speakers, I want you to think about it now from the perspective of not just a mental illness and not just a diagnosis of cancer, but think about co-occurring conditions. Very seldom does someone just have a mental health condition. There's almost always something else going on. Receiving a diagnosis of cancer is catastrophic. we teach in our education programs that learning you have a mental illness is also catastrophic. And we respond pretty typically to catastrophic stressors. They're things we weren't ready for. We really don't know how to respond to them. We don't have any experience with them. And we're really not sure what the rest of the world is going to think about whatever it is, whether it's our employer, whether it's our family member, whether it's our religious community, whoever it happens to be. We're just not really sure how people are going to see us. So on top of having physical symptoms and mental illness symptoms, you also have that extra level of social angst that comes along with it. So it can end up being what we call at NAMI a problem pileup, where it's kind of like pouring gas on a fire to have that second diagnosis or to have the diagnosis of cancer, and then you begin experiencing the mental illness, the mental health condition symptoms that are causing you trouble. Typical normal responses when you're faced with a catastrophic diagnosis like cancer, but they can become problematic in and of themselves. And it's kind of like pouring gas on a fire. You know something's going to happen. You just don't know how big the something is going to be and how much more complicated it's going to be to get things under control again. And you see on this slide, it just kind of becomes a feedback loop of the symptoms building on each other, and it gets into the problem pileup that I was talking about. If you think about physical health and mental health as being think of it as a circle. It each affects the other. One is not more important than the other, and they can both feed and make the other. Good mental health can help you be able to deal with other physical conditions that you're going through. But by the same token, having trouble with your mental health can interfere with your ability to get better and to improve with the other physical conditions. So they really are so interconnected. It's a balance. It is what it is. It's not fair. It stinks. But the biggest thing is to be aware that it's there and to be aware that there are things you can do about it, not things that will fix it, not magic things that will make it go away, either one of them, cancer diagnosis or the mental health symptoms, but things that can help you feel so not alone. Both of these illnesses, regardless of the specific type, the specific variety of mental illness or of cancer, you can feel so alone and so isolated. Finding support, finding help, finding a way to navigate the resources. Almost every speaker today so far has talked about one of the challenges being, how do you find? How do you pay for? Where do you go? And that's a place where NAMI can help. We have a helpline that you can reach, and you see here there's a chat feature on our website. There's also a 1-800 number. We have a relationship with the crisis text line where you can text NAMI to the crisis text line and reach someone. We have expanded our helpline hours during the pandemic from 10 a.m. to 10 p.m. so that there's to accommodate the East Coast and the West Coast. And we'll be adding the chat feature we'll be adding a text feature. I'm sorry, chat feature we added last year. We'll be adding a text feature soon. So you can find support right now today. Just, where do I go for help? Who do I call? Who's available in my community? How do I apply for disability? What does Medicaid cover? We don't have all the answers. We can tell you what we know, and then we can point you in a direction to find the answers. And if I could click my slide, that would be great. There we go. You can also go to our website, NAMI.org, find your local NAMI and find the NAMI that's nearest you. Even if there's not one in your community, there is one in your state. And they'll have more information. Sometimes it's even, ask for Teri when you go to the Medicaid office in Jackson, Mississippi. She's really good with folks who are having trouble like we're having. Little things like that. Just talking to someone who's walked that same road can make so much difference. So you can find the NAMI that's closest to you or your state. You can go to our webpage and click on where the arrow is pointing, support and education. We offer family support groups for family members of people who are experiencing mental health symptoms. We don't care about the diagnosis. We don't care about how long they've been having trouble. It doesn't matter what else is going on. It's support for family members who love someone who's having difficulty. We also offer support groups for the individuals themselves who are experiencing the difficulties. And we also offer education classes, helping people understand that this isn't your fault. It's not something you did or didn't do. And most importantly, to help people find hope and hang on to that hope, which can be even harder when you're also dealing with something as devastating as a cancer diagnosis. So David, that's a quick run through, and I have a couple of resources that I made available to David and to Emily that they'll be sharing with you. And you can also find them at our website, Navigating a Crisis, and a family guide. You know, what do you do if you're a family member? What do you not do? How do you keep from making things worse? And most importantly, I want to thank all of you for joining the call today and what you do every day to take care of the people that you are trying to support. Thank you, David.